Hello, my name is Mary Richards, and I am here to testify against the bill that Senator Jan Jones has introduced, which will amend the Child Nutrition Reauthorization Act. If passed, it will ultimately require all states to receive federal funding so that schools can conduct annual BMI screenings in grades K through 12, and each child who is labeled as on the higher end of the BMI will then be referred to a nutritionist. Thank you for the opportunity for me to speak on behalf of the students, parents, teachers, and other concerned community members of the state of Massachusetts, as well as the nation. Obesity in the United States has reached epidemic levels within the past few decades, and it's now becoming a public health crisis. Children make up a large part of this affected group, with 1 in 5 being labeled as overweight and at risk. If this is not controlled and addressed, this will lead to a lifetime of chronic health conditions such as diabetes, cardiovascular disease, and high blood pressure, which will then create more work for our public health professionals and put more strain on our health medical systems. School is a good place to begin the application of these behavioral changes, with special attention being paid at home to help reinforce them. That being said, Senator Jones' BMI surveillance program doesn't take into account the possibility of lack of family involvement, socioeconomic factors such as low income, and the potential for detrimental weight management techniques from children who have been identified as overweight. A study was conducted at 2 pediatric offices in Arkansas where parents were given questionnaires regarding their thoughts surrounding the BMI surveillance in their kids' schools. More than half of the parents stated that they did not change their child's diet or activity levels based on the category of BMI that they fell into, which shows that this type of program would just be an ineffective option. A better alternative to monitoring BMI is implementing nutrition education directly into school. This would address the issue of detrimental weight management techniques because everyone would be included in the intervention and get the same information instead of singling out only the students with a higher BMI. A study done by Yale followed students from 12 different schools in New Haven, focusing on their nutrition education or lack of. The resulting data showed the students that took part in these lifestyle courses had healthier BMI trajectories as well as better behaviors when it came to eating. My final recommendation is for nutrition education to be added directly into all public schools by 2030. Although education is primarily the responsibility of the state and local governments, this is a situation in which regulations need to be developed at the federal level by passing a nutrition education law. The goal would be to mandate specific courses that focus on the adoption and use of food-related behaviors that are beneficial to an individual's health and well-being by using the framework provided by the National Health Education Standards. Funding support from the U.S. Department of Education should be used to hire new teachers or train current ones, specifically in less fortunate communities. This way, every public school would have the same curriculum and would all be working towards the same goal, which is tackling obesity. This will lead to better health in all communities, which will then lead to better health across the nation. Thank you.